at the point of care. So we didn't name it DermDx, we named it VisualDx, and VisualDx can handle any symptom, any complaint. The need we're trying to fill is this huge problem we have that Dr. Chu mentioned this morning about diagnostic error. It's pretty clear that about 15% of all diagnoses are wrong. So when we started collecting many, many images, and we also started developing a knowledge base. And first of all, an apology for this image during lunch, but if you know a dermatologist, this is what dermatologists do. They always show horrible images while people are eating. So this is a picture taken by Dr. Brown, and our number is 43 seconds. And I chose 43 seconds because at the point of care, you have to be fast. And if you're not fast, clinicians are not going to use clinical decision support. So Dr. Brown had a resident come to him last year and say, we have an elderly woman in cubicle 5 that developed this lesion. It started small, she tied a string around it, she ripped it off, and 2 weeks later it grew back 5 times the size. And I don't know what it is, Dr. Brown. So that's the resident reporting to the attending. Dr. Brown, who's the chair of emergency medicine at University of Maryland, said, well, I have an app for that. The University of Maryland had licensed our system last year, and he pulls out the phone, he takes this picture, he has permission from the patient to have the image used, and takes the picture, and he's using our app, and there's the picture in the app, and it analyzes the image, and it does it in less than a second on the iPhone. So we're using a technique that Apple's developed to put your machine learning algorithm on the phone itself. So it's using something called Core ML. So on an iPhone 7 or faster, it's analyzed in a second, and we have to put a progress bar there, a dummy progress bar, because when we did our initial usability testing, the doctors didn't know anything happened. It happened so fast. So we put this dummy progress bar that creeps along for 2 seconds, and then on the bottom of the screen, it shows the skin lesion morphologies. And so one of the things that we're advocating is that we think about AI not as artificial intelligence, but AI as augmented intelligence. And one of the keys to good dermatologic diagnosis is to be able to describe what you're seeing. So non-dermatologists see 65% of skin disorders. Only 35% of skin disorders are handled by dermatologists. So they're seeing primary care physicians, they're seeing ER docs, and to variable success, physicians that are not dermatologists range from calling it, it's a rash, or it's a lesion. They don't really describe what you're seeing. So one of the things that we did over the long track record of our company is we encoded all the images by the morphology in the picture. So we've coded the images with words like in the lower left, it says friable papule, and then it says skin ulcer, and it says skin erosion. So the machine learning picked it up. The best results were 3 out of 80 morphologies. It puts it at the bottom, and then Dr. Brown says, well, I don't know what friable papule means, but the picture looks like the patient. And then he adds that it's on the fingers, and it gives them a differential diagnosis. So the other part of thinking about AI as augmented intelligence is to really think about how are we enabling the differential diagnosis process. So rather than just saying AI believes it's a 99% probability that it's this diagnosis, to really be safe, I think here in 2019, we always have to be thinking about the differential diagnosis. So Dr. Brown gets this differential diagnosis, and he sees at the very top this bloody thing on a finger, and so then he clicks that, and the next screen shows him examples of lobular capillary hemangiomas, also called pyogenic granulomas, many images of this benign tumor on fingers. And he's exploring this in the exam room in front of the patient with the resident, and he told me it was a thinking out loud process. And the patient loved that he was doing it. Now this is a huge change in healthcare, because doctors used to say to us when we started our company, I would never look things up in front of the patient. It would show that we don't know. But now patients are on Google for an hour or two before they see us. And so when we come in and we only spend a minute with them, they're really wondering, do we know? So the fact that Dr. Brown had this tool that he was doing and explaining to the patient actually built confidence in the physician and from the patient's perspective. Another point is that we've been systematically collecting images for 20 years and purposely making sure that we have imagery of disease across all skin types. So light skin, all the way, we call this Fitzpatrick type 1 through 6 in dermatology. 6 would be very dark skin. And so we've been collecting these images and tagging them as well by the skin pigmentation type, so that the machine learning is also trained across the spectrum of skin disorders. And that was the image that helped to confirm the diagnosis. And he did that in 43 seconds. He went from the process of taking the picture, putting in finger, reviewing the differential diagnosis, and coming up with the likely answer. And he texted the image to the dermatologist at the university, who responded more than 24 hours later saying, "Good job, Dr. Brown, you nailed it." So one of the needs that we're filling is this global shortage of specialists. So here in the US, we're very specialty focused, but around the world, there are no dermatologists. In certain parts of Africa, there are just certainly no dermatologists. So driving this technology to the generalist is a really key thing. And next up for us is we've created an app called ASA, A-Y-S-A, that's now available on Android and iOS for consumers. So you can get self-triage as well. Thank you.
Thank you very much. Apps such as these do require an enormous amount of input data to train them adequately. How is your company addressing privacy issues?
So in terms of privacy, dermatology, unlike radiology, you actually can recognize yourself. It's very hard for a person to say, that's my chest x-ray, or that's my bone film. But in dermatology, we've always had a need for using imagery to teach patients. And so we used to have this stuff called film and this stuff called Kodachromes. And dermatologists collected images on film and Kodachromes for years, and they would develop a relationship with the patient, and we'd have signed consents, and we'd ask the patient if we could use their image for teaching. So during the lifespan of our company, we've been methodically and seriously collecting images from a HIPAA perspective, an ethical perspective. We don't put black bars across the images. We crop images. We have written permission from patients. And we've done it in a way that we have an image collection manager who's been with us for 17 years, and she's gained the confidence of physicians that have spent their life collecting images, so they trust us. So a big part of what we're doing, it's not a wiki model. It's working with physicians and universities that want to share their images to improve diagnosis.